Good day, everyone. Welcome to Ready, Set, Go, a webinar series sponsored by HUD's Office of Special Needs Assistance Programs, known as SNAPS. My name is Mark Allison, and I work at the Center for Social Innovation, and today I will serve as the moderator of our webinar. The Ready, Set, Go webinar series, and SET is an acronym which stands for SNAPS E-Learning Tuesdays, will be held every Tuesday at 3:30 p.m. Eastern Time. The Ready, Set, Go webinar series will provide valuable information for continuums of care, HMIS administrators, grantees, project sponsors, and other stakeholders on a variety of topics focused on community planning and capacity building. On behalf of SNAPS, I would like to thank all of you for joining us. Today's webinar is called Preparing for Your 2012 Housing Inventory and Point-in-Time Counts with Special Attention on Veteran Program Guidance. We are lucky to have three national experts presenting today. John Kuhn is the VA's National Director of Homeless Evaluation. In this role, he has worked with federal partners to develop processes that will help identify the needs of homeless veterans and the effectiveness of services designed to assist them. As the VA's Acting Director for Supported Services for Veterans Families, Mr. Kuhn has coordinated the development and launch of the VA's new Prevention and Rapid Rehousing Initiative. For the past several years, he has also co-authored the VA's Challenge Report, a community assessment on the needs of homeless veterans. Matt White is a senior associate at Apt Associates and has been in the homeless technical assistance field for 15 years, specializing in strategic planning and homeless system policy development, research and evaluation, and homeless management information system, HMIS development. Molly McEvely is a senior analyst at Apt Associates. She is the task lead for the management of the Homeless Data Exchange and the Housing Inventory Count guidance and training. She is also involved in other projects, including working on the next revision of data standards, the development of programming specifications for HUD reports, and the VA HMIS integration project. Before we get started with the presentation, I would like to make a couple of logistical announcements. Today's webinar will last 1 hour and is being recorded. The webinar recording and PowerPoint presentation will be posted next week on the HUD Homelessness Resource Exchange website at www.hudhre.info. Over 700 people registered for this webinar. Because of the large size of the audience, all attendees will remain on mute for the duration of the webcast. All of your questions are important to us. You can submit any questions, concerns, or technical matters that you have via the GoToWebinar questions dialog box on your screen. We will try to answer some of these at the end of the presentation if there is time. You may also submit questions to HUD's virtual help desk. Poll questions will be asked during the webinar to get your feedback on the information presented. Your responses help give us a sense of how the webinar is going. As a reminder, you will remain muted throughout the call. Now I'd like to turn it over to our first presenter, John Kuhn.
Good afternoon to most of you, and I'd like to first just touch on some of the objectives we want to cover for today. First, we want to give you an overview and describe some of the VA's plan for HMIS, that's the Homeless Management Information System, and how you and your participation will make a difference towards the goals that we all share to end homelessness. We want to talk in that regard also about the homeless inventory count and the point-in-time counts, and what data we need for the HIC and the PIT, and how that data will influence some of the decisions we may make, and how those decisions are driven by this data. Furthermore, how you prepare the HIC and the PIT, and how VA programs, programs serving veterans, are expected to be included. So first, let me start with the the high-level view, and that's the federal plan to end homelessness and to prevent homelessness. And that was produced by the Interagency Council on Homelessness. The report is known as Opening Doors. Hopefully you all have seen it. If you haven't, I certainly encourage you to go on the ICH website. Many other websites have it now as well, and download it. But essentially, it talks about some of the main strategic goals to meet the overall goal of ending homelessness among veterans in 5 years. And certainly, to be effective, one of the goals describes how we really need to increase our knowledge base. And the reasons for that are quite obvious. if we're going to be successful, we need to understand who is homeless, where the homeless persons and families can be found, and what interventions might be working. These goals can only be achieved with accurate data, which is really the subject of today's call. Next slide. So some of the VA's efforts have been going on for many years as HUDs, but very often in the past, VA and HUD had sometimes parallel data systems that didn't often communicate very well together. So over the past couple of years, VA and HUD have worked together to combine data so we can have a better understanding of the full needs of homeless veterans in a single system. To improve our understanding of VA and HUD data, we've taken a number of steps. First, and perhaps most importantly, is we've been working to combine our data systems in HMIS. So that way all of our community providers are going to be putting data into HMIS, and more on that in a bit. HUD has also asked all the communities all COCs, to collect data on veterans who are both sheltered and unsheltered, and that would show up in the PIT, and also it's described in the Veteran Supplemental Report to the AHAR, another important resource for anyone who's serving homeless veterans. And the Secretary of the VA has instructed all VA staff to work closely with continuums of care, to work with the COCs in both planning purposes and also on the PIT surveys and the HIC. This way we can, again, get more comprehensive counts, involve all the local experts in this process, and certainly this will help for coordination efforts as well. Next slide, please. So as part of the requirements to have this, or our goal is to have this full participation in HMIS, we've really made a goal for us for this year to have all VA-funded homeless assistance programs in the community fully participate in HMIS. So we have instructed all of our grant per diem, that's the VA's transitional housing programs that we fund, all of our health care for homeless veterans, residential contract beds, and also our new supported services for veteran families programs. All of those are now reporting into HMIS. It is vital that this happens so we can get a full picture of data of veterans who are served on the national level, but also so locally you have the information you need to develop planning for your services for area veterans. Eventually, we want to be able to share our data back to you. The data is now described in what we call the VA the home system, which is the VA's internal data system to capture services that we deliver to homeless veterans. We do know that there are a number of technical hurdles that have to be overcome, and privacy hurdles, but we do want to make that available to COCs by 2013. That will be identifiable data whenever possible. So that gives you sort of a very general sense of what the VA plans to do and how we need to work with HUD. Some of the results, again, you've already seen through the Veterans Supplemental Report to the AHAR. Now we're going to get into more detail on exactly how that looks for you locally as a provider and as an agency. So I want to turn this over to Molly, who's going to go into those efforts in more detail.
Thank you very much, John. Before we talk about the specifics of the housing inventory count and the point-in-time count, I would like to talk a little bit about the generalities of the reports themselves. The housing inventory count, or the HIC, is an annual report to HUD. It is compiled and submitted by COCs, and it includes data about organizations, programs, bed and unit inventory. It isn't very creatively named. The title of the report pretty much describes the content of the report. It gives HUD information about the community's capacity to house persons who are homeless. And because that capacity tends to fluctuate over time, the HIC looks at inventory on a during the last 10 days of January. Next slide. The point-in-time count, or the PIT, provides HUD with data needed to understand the number and the characteristics of persons who are homeless at a single point in time, or perhaps more accurately, on a single night during the last 10 days of January. It reports data on both sheltered and unsheltered persons who are homeless. The sheltered count beginning in 2012 will be required annually. The unsheltered count is required in odd years. So it is optional in 2012, but the data is always welcome. And COCs are able to submit an unsheltered count in 2012 if they desire. Next slide. So taken together, the HIC and the PIT provide a data snapshot of both of the persons who are homeless in your community and the capacity of your community to house them. They are integrally related and they should be conducted on the same night. At the program level on the housing inventory count, the COC provides a count of people who were in the program on the night of the count. When you add up those numbers by program type, the total number of people reported in emergency shelter, transitional housing, and safe haven programs on the HIC should equal the total number of persons reported in the sheltered PIT count. The HIC and the PIT they work together, and often they are done by different people, but those different people should coordinate with one another to make sure that their methodologies match up, that their dates match up. They should also work within the COC to coordinate the execution of the housing inventory count and the point-in-time count. The use of HMIS is strongly encouraged in producing the housing inventory count and the PIT count. However, you want to do this with the coordination of program staff, coordination with program staff. Next slide. I am now going to turn this over to Ms. Rothschild for a poll question.
Thank you. So we have some interactive polls here for everybody, and we're going to ask you to respond and sort of let us know how we're doing with information. So the first poll question is, who completes the PIT, the point-in-time count, and the HIC, the housing inventory count? Is it either the COC staff, the service providers, or the VA staff? We'll just give you a few minutes to respond to the poll. Okay, so I see that the majority of the people picked COC staff, which is correct. So we do expect the COC staff that are completing the application and who work on this daily to complete the point in time and the HIC and to provide that information to HUD.
Okay.
So yeah, go ahead.
Okay. So we've already made a couple of references to the night of the count. This has in the past caused a confusion. So in preparing for this presentation, I looked up night in the dictionary. And Night is defined as the period of darkness between sunset and sunrise. You might notice on the timeline at the bottom of this slide that what we refer to as the night of the count actually crosses two dates. So a date begins at midnight and ends around midnight. It's a 24-hour period. And when you are filling out your HIC and your PIT, you have to identify for HUD what date you conducted your point-in-time count and your housing inventory count on. The date identifies the night, and the night starts at sunset on the date that you identify, and it runs through sunrise on the following day. So if you select January 25th as your date, and you are sending people out at, say, 3 o'clock in the morning to do an unsheltered count, which isn't required but is always welcome, you want to make absolutely certain that before you send people out at 3 o'clock in the morning in January, that you have correctly identified for them the date, which 3 o'clock in the morning you want them to go out on. So if you identify the date of your count as January 25th, the night of January 25th starts at sunset, January 25th, and it runs through sunrise on January 26th. So if you have a team of people going out at 3 o'clock in the morning to conduct the unsheltered count, you would send them out at 3 o'clock on the morning of January 26th. Even you're identifying the date of the count as January 25th, but that runs through sunrise on the 26th. Next slide. The housing inventory count is, as I mentioned before, a snapshot of housing for persons who are homeless in your COC on one night, actually. And the data components of the HIC describe the basic components of a continuum of care. Organizations, programs, and within those programs, bed and unit inventory. Next slide, please. The program types to include on the housing inventory count include residential COC programs who in the following 5 program types: emergency shelters, transitional housing, HPRP, and those are rapid rehousing beds only, and we'll talk about the details of that in a couple of minutes, safe havens, and permanent supportive housing. In enumerating your housing inventory, you should only include beds and units that are dedicated for persons who are homeless. You should not include beds and units that maybe serve homeless people incidentally, but might be used by non-homeless people. This inventory of beds and units dedicated for people who are homeless. Next slide. When you are completing a housing inventory count, you should include housing programs for the homeless that are funded by HUD, also programs that are funded by the U.S. Department of Veterans Affairs, or VA, faith-based organizations, and any other private and public funding sources that are operating residential programs dedicated to homeless clients. Next slide. So programs that receive any part of their funding from the VA, from the specific VA programs listed in the following slides, must have the VA in their program names and must be assigned the program types agreed upon by HUD and VA. We are going to go through a list of specific VA program types, and as you include these programs in your housing inventory count, their names should be prefixed with a prefix that will be identified on the following slides that identifies to HUD what type of VA program they are. And the HUD program type, emergency shelter, transitional housing, etc., is something that HUD and VA have agreed upon, and there is no flexibility in assigning a program type there. If you have a grant and per diem program, you must assign the program type that has been agreed upon by HUD and VA. In preparing the housing inventory count, COC leads coordinate with VA program staff and with program staff in all of the programs to review and verify the inventory included on the housing inventory count. Next slide. So the first program is the VA Grant and Per Diem program. In listing this on your housing inventory count, you would prefix the program name with GPD, and the program type for grant and per diem programs is transitional housing. Grant and per diem programs have been instructed by VA to participate in HMIS. They should be entering the universal data elements into their local HMIS. The VASH program, or the Veterans Affairs Supportive Housing Program, is a permanent supportive housing program, and the prefix for this is VASH, V-A-S-H. These programs, VA staff are prohibited from entering client-related data into HMIS systems, but HUD-VASH programs can partner with local housing authorities who are permitted to enter this data into HMIS. If it is possible, VA encourages HUD-VASH programs to partner with their local housing authorities to get HUD-VASH data into HMIS. Next slide. The next group of programs are community contract beds, and VA has instructed the community contract providers that they should be participating in their local HMIS. The Healthcare for Homeless Veterans VA Community Contract Emergency Housing Programs, the prefix is HCHV/EH, and the program type is emergency shelter. Healthcare for Homeless Veterans VA Community Contract Residential Treatment Programs, the prefix is HCHV/RT, and the program type is transitional housing. Healthcare for Homeless Veterans VA Community Contract Safe Haven Programs, the prefix is HCHV/SH, and the program type is Safe Haven. Next slide. These next two program types are not into HMIS, but the information about the programs themselves, the organization, the program name, the bed and unit inventory, should all be in your HMIS, the program descriptor data elements about these programs. And they should be included on your housing inventory count and your point-in-time count. The VA Mental Health Residential Rehabilitation Treatment Programs, Domiciliary Care for Homeless Veterans, the prefix is VA DOM, and the program type is Transitional Housing. This program type is new for this year. Last year, the VA DOM beds were reported in the emergency shelter category. This year, they are to be reported in the transitional housing program category. And then the VA compensated work transitional residence. The prefix is CWT/TR, and the program type is transitional housing. Next slide. And again, I am going to turn this over to Louise for a poll question.
Thank you. So the next poll question says, will the VA domiciliary programs be listed on the 2012 point in time and HIC as emergency shelter? So we'll leave that open. We'll give everyone just a few more seconds. Okay, so it looks like 68% of you got this correct. No, the VA domiciliary programs will not be listed on the 2012 point in time and HIC as emergency shelter. They will be listed as transitional housing. Okay, turn it back over to Molly.
That was a little bit of a trick question because that is new this year. The domiciliary programs should be included in the point in time and the housing inventory, but they should be included as transitional housing. Okay, according to HUD's HMIS data standards, which were updated in March of 2010, all homeless assistance and homelessness prevention programs that are part of a COC's homeless system must have program descriptor data recorded in the COC's HMIS. Program descriptor data that is recorded in HMIS is incredibly useful in completing the housing inventory count, and the data that's in the HMIS must match the HIC data that is reported by the COC. Having said that the data is useful and that the use of HMIS data is very strongly encouraged, not all elements of the housing inventory count can be derived from HMIS. There are two components that describe programs, and you can't get this information from HMIS at this point. That is information about whether or not the program is McKinney-Vento funded, and information about whether or not the bed and unit inventory is designated for households with only children, which is a new category in the HIC this year. Next slide. So we are going to walk through the data components that make up the housing inventory count. The first is the organization name. The organization is the largest and most basic component of a COC, aside from the continuum of care itself. Every program belongs to an organization, and an organization may have more than one program, but a program should not have more than one organization. Next slide. The next component is the program, and the program has a number of characteristics: name, program type, geocode, target population A, which is optional, target population B, which is not, and information about whether or not the program is McKinney-Vento funded. Each program should have one and only one value for each of these elements. A program has only one name. A program has only one type. If you have an organization in your housing inventory that operates both as an emergency shelter and as transitional housing, those are two separate programs, and they must be separated with 2 different program names in the housing inventory count. If you read the data standards for fun or profit, you may notice that in the data standards, the geocode is part of the site information data element, and the data standards allow for entering data pertaining to multiple sites for a single program. The geocode used for the HIC, the geocode that's associated with the program and the housing inventory count, should be the geocode in which the most beds are located at the time of the housing inventory count. Next slide. The next level of information is bed and unit information. These data elements describe the bed and unit inventory, what household types are reserved for, what are the bed types, when are they available, how many are there, are any of them reserved for chronically homeless, when did the inventory become available, if it's no longer available, when did it become unavailable, how many of the beds are participating in HMIS, when did they start, if they've stopped, when did they stop, and is the inventory current, new, or under development. So as you look at this list of information, check your HMIS. Can you enter this information? If you cannot, check with your HMIS administrator. If you are your HMIS administrator and you can't enter this information and you don't know how to set yourself up to enter this information, contact your vendor. If you can enter this information, is the information current? Programs that are physically located in multiple COCs should be recorded as distinct programs within each COC's HMIS. So if a program has 50 beds and 20 are located in another COC and 30 are located in your COC, you should create a program record for the program that's affiliated with your COC, and your bed and unit inventory should have a record of 30 beds, the 30 beds that are located in your COC on the night of the HIC. The other COC should also, which is not your problem, but just for the record, the other COC should also create a program record that is affiliated with their COC, and they should enter 20 beds. And again, COC leads should work with program staff to verify inventory information to determine which programs, where beds are located in which COCs. Are they still available? Were they available on the night of the count, or was there a sprinkler explosion and they were soaking wet? It's very important to not rely just on the HMIS data, but to communicate with program staff. Next slide. So one of the components of bed and unit inventory information is the household type that the bed and/or unit is designated for. And in 2012, new this year, we have beds that are designated for households with at least one adult and one child, households with only children, and households without children. These household types are with the household types on the point-in-time count and with those that are reported on HUD's Annual Progress Report, or APR. Households that are composed only of people who are under 18, that's unaccompanied youth or unaccompanied children, a minor parent with a child, or any other combination of people under 18 should be counted in the category of households with only children. Households that include at least one child and at least one adult should be counted in the category of households with at least one adult and one child. The March 2010 HMIS data standards do not include a response category for households with only children for data element 2.9a, which is the household type in the bed and unit inventory. So programs that have inventory that is designated for use of households with only children should provide this information, and the COC lead should ask about this information when coordinating with program staff. And care should be taken to make sure that this inventory is included on the HIC only in the category of, in the appropriate category. If it was reported in the households with children category last year, it should be reported only in one category this year, or the beds should be split up. But beds should not be reported in both categories. Next slide. Programs that serve multiple household types and do not have a specific number of beds designated exclusively for a single type have two options in reporting this inventory on the housing inventory count. In previous years, the instructions for the HIC were to divide the number of beds based on the usage on the night of the count. So if there are 50 beds and on the night of the count 30 were used for households with only children and 20 were used for households with at least one adult and one child, you would report exactly that on the housing inventory count. This is somewhat in conflict with the instructions in the data standards, which say that the beds should be divided up based on average utilization. So because the instructions in these two integrally related tools have been somewhat in conflict with one another in the past, for this year you have the option with either the data standards methodology, which is described in more detail in the data standards, or with the previous HIC guidance. If you have any questions about this as you're working through it, you can submit a question to the help desk. We'll provide the URL of the help desk at the end of this presentation. Next slide. In reporting on bed types for emergency shelter programs on the housing inventory count, beds fall into three different categories. They are either facility-based, voucher, or other. Facility-based are beds that are located in a residential homeless facility. And again, to reiterate, you should be including that are designated for use by homeless persons. Voucher beds are beds that are located in a hotel or motel and are paid for by the program. And then other beds are located in a church or another facility that is not designated for use by homeless persons, but the beds themselves on the night of the count are designated for use by homeless persons. Next slide. Another aspect of bed and unit inventory information is the availability. And again, this applies only to emergency shelter beds. And beds are available either year-round, seasonally, or on an overflow basis. Year-round beds and units, this might be self-explanatory, but on a year-round basis. This does not mean that you are signing away your firstborn to HUD and promising them that these beds will be available 365 days of the year, but it does mean that they are not seasonal beds and that they're not overflow beds, that in general, this bed that is available on the night of the HIC is a year-round bed. Seasonal bed, by contrast, is available only during high demand times. There's a set start and end date during perhaps winter, when demand might be higher. And then overflow beds are beds that are available on an ad hoc basis during the year when demand exceeds planned bed capacity. An example of this might be a closet full of mats that when all the beds are full, staff can open up this closet and start passing out mats and blankets. In reporting on year-round beds and on seasonal beds on the housing inventory count, you are reporting on the number of beds that are available, regardless of how many people are in them. In reporting on overflow beds, you are going to be reporting on the number of overflow beds that are occupied on the date of the HIC. HUD doesn't really care if you have a stack of 75 mats in your closet if there was nobody sleeping on them. So on the night of the count, if you have 5 people sleeping on those mats, you would report 5 overflow beds. Next slide. As I mentioned on the last slide, in general, the inventory count, you are looking at the number of beds and units that are available on the night of the count. The difference is beds that are under development, and we'll get to under development in 2 slides. Overflow beds, as already mentioned, that's the number of occupied beds. And then HPRP rapid rehousing beds. And this is also going to be a count of occupied beds, or more specifically, a count of people who are in the HPRP RRH program, who were literally homeless at program entry, who are receiving HPRP assistance, either in the form of housing relocation and stabilization services or financial assistance, and who are occupying conventional housing. You do not count people who may be enrolled in the HPRP program but are perhaps still in emergency shelter or transitional housing. You only count the people, and because this is going on the housing inventory count, you're recording a count of beds. It's a count of people who meet these conditions. Next slide. So if you have a fixed number of units but no fixed number of beds, a program may estimate the number of beds by multiplying the number of units by the average household size. The example on this slide is very, very simple. If you have 10 units for households with at least 1 adult child and an average household size of 3, you would multiply 10 units by the average household size of 3 for 30 beds. If your average household size is 2.7, you would multiply 10 units times 2.7 and come up with 27 beds for households with at least 1 adult and 1 child. Next slide. The last characteristic of bed and unit inventory is inventory type, and this cannot be pulled directly from HMIS, although it is based on the inventory start date and the inventory end date, which are data elements included in the HMIS. This identifies whether the beds or vouchers that are available, the beds or vouchers that you're recording, current, new, or under development. Current beds are beds or vouchers that are available on the night of the HIC and are not new since the last HIC. New beds are beds or vouchers that represent an increase in capacity since the last HIC. So it's not just that you replaced old, creaky, falling apart beds with new beds. It's the number of beds by which you have increased the capacity of that particular program since the last housing inventory count. And then beds that are under development are beds that are fully funded but not yet available at the time of the HIC. So if these were entered into HMIS, they would have an inventory start date that was after the date of the HIC. And one would not expect to find in beds that are under development. So the last component of the HIC is a point-in-time count for each program. And because the point-in-time count for each program is integrally related to the point-in-time report, I am going to turn this over to Matt White, who will talk about the PIT count aspect of the housing inventory count, and then go on to discuss the particulars of the point-in-time count report.
Thanks, Molly. So on the next slide, we see the integration of the HIC and the point-in-time. And as Molly certainly indicated, the HIC and the point-in-time are interconnected. Each program recorded on the HIC must also provide a point-in-time count. The number of unduplicated clients counted in emergency shelter, in transitional housing, and safe haven programs on the night of the point-in-time count will represent the continuum of care's sheltered count. On the next slide, the point-in-time guidance. Each year, continuums of care must undertake a point-in-time count, which is the total unduplicated accounting of all persons who are homeless. The PIT count is completed during one of the last 10 days in January, as Molly indicated earlier. While each year, the point-in-time count always includes homeless persons who are sheltered, HUD only requires a count of unsheltered, or the street count, every other year. The unsheltered count is not required, as we said earlier, in 2012. It's optional. You may do it, but it's not required. Next slide. During your point-in-time count, each continuum of care will collect data on 3 different household types. These will obviously look familiar from Molly's review of the HIC earlier. The 3 household types include persons in households with at least 1 adult and 1 child, persons in households without children, and persons in households with only children. Continuums of care will count both the number of persons and the number of households for each household type. Next slide. Subpopulation data. HUD requires the continuum of cares to collect data on specific subpopulations for all sheltered persons. Now remember that the unsheltered count is optional in 2012, but if your continuum of care does complete an unsheltered count, you still have to report the counts by subpopulation. The subpopulations include chronically homeless individuals, chronically homeless families, and the number of households, veterans, and then continued on the next slide, subpopulations also include severely mentally ill, chronic substance use abusers, persons with HIV and AIDS, victims of domestic violence, and unaccompanied children or kids under the age of 18. So who gets counted? On our next slide, we see that for the sheltered count, we include all persons who, on the night of the count, were sleeping in beds that are designed for persons who are homeless and are funded by emergency shelter, transitional housing, or safe haven programs. If you're conducting an unsheltered count, you'd include all homeless persons sleeping in places not meant for habitation. Next slide. So who does not get counted? We do not count persons residing in the following situations on the night of the count. So they should not be included in your sheltered point-in-time count. PSH residents or permanent supportive housing residents, obviously they're in permanent housing, so they do not have homeless status. Persons living doubled up who may be staying with family or friends, obviously in distressed housing situation, but they do not count as literally homeless. Persons staying in beds that are part of programs that are not dedicated to serve homeless persons. Oftentimes these might be treatment beds where homeless persons can access that resource, but the bed itself is not designated for persons who are homeless. And we do not count any person residing in housing that's subsidized with HPRP or SSVF program funds. Those do not get counted. Next slide. Looks like we have a poll question, and I'll ask Louise to jump in.
Okay, so for this question, should persons who are housed with assistance from HUD VASH be included on the point-in-time count? And we'll open it up and give you a few seconds to respond. Okay, great. So 65% had the correct answer. Should HUD VASH be included on the point-in-time count? And the answer is no, because it is considered permanent supportive housing. Okay, Matt, would you like to take it away?
We've certainly covered a lot of territory, and there have been some important changes from the 2011 HIC and point-in-time guidance that you'll need to pay attention to for 2012 that might be a bit different. So I encourage you to review guidance on the 2012 housing inventory count and point-in-time count. And HUD is in the process of preparing detailed guides for counting and estimating sheltered and unsheltered homeless persons. You should look for those guides in the coming months. The slide that's on the screen now lists the website where you might be able to download the 2012 HIC and point-in-time guidance. So make a note of that and access that guide as you're preparing your count for this coming year. Although we try to stay on time with these, I do think we have a couple of minutes, although we've finished all of the presentation remarks. I think we have a couple of minutes to cover maybe some questions that have come up through the course of the webinar, or themes that have emerged around something that might have been a bit confusing or something that we can clarify. We have two resource advisors who've been working on the chat function to review questions and respond to questions as they come in. So I'll ask both Louise and Tom to chime in and see if we have maybe an opportunity to clarify some guidance that was described earlier where we might have received a number of questions, or if something has come up that we can respond to now.
Okay. One thing that we wanted to do is to go back a little bit. And Matt, could you clarify for everyone what we mean by COC staff, since some COCs do not have dedicated staff?
The CFC refers to the system of care and all of the programs that work together to provide care for persons who are experiencing a housing crisis. But CFC staff refers to the specific individuals who are designated to enter and provide and submit and verify data on behalf of the CFC in the HDX. So for purposes of this presentation, we talk about CFC staff who prepare the PIT and HIC and then certify those data. We're talking about the people who submit the data to the HDX. I think there might have been another question that came up earlier for continuum of care staff who may be only just slightly familiar with VA programs and wanted to get a little bit more information about exactly how to understand which VA programs should be included in the HIC and point in time and how to include them. Although we did cover this in detail throughout the presentation, I do want to encourage continuum of care staff to reach out to VA staff in their community who are best positioned and prepared to participate both in the planning efforts around the continuum of care and to answer questions about VA-funded programs and how those programs should be engaged and included on the HIC and point in time. Each VA medical center has a staff person who's designated as a homeless coordinator who works not only with veterans at the medical center who might be experiencing a housing crisis and make sure that those persons are accessing VA benefits. The homeless coordinator also is an important resource for continuum of care staff to begin the process of coordinating across these two federal partners, HUD and the VA, and make sure that veteran programs and veterans themselves are integrated into the broader continuum of care planning process. So encourage continuum of care staff to reach out to their counterparts, the homeless coordinators at the VA medical centers. Any other questions, Louise, that we can respond to in the remaining couple of minutes?
I think that there was some confusion about how HPRP is included in the HIC. Maybe Molly could go back through that a little bit real quickly. I think there was some confusion about who to include in the HIC and which parts of HPRP not to include.
Okay. First of all, we want to distinguish between the HIC and the PIT in terms of HPRP. So when you're counting, let's start with the PIT because it's a little more straightforward. When you're counting people on the point-in-time count, you are including people in emergency shelter, transitional housing, and safe haven programs. You are not going to count anyone on the PIT because they're in an HPRP program. However, you might have people who are enrolled in the HPRP program and they're still in emergency shelter or may even be in a transitional housing program. Those people you want to count, but you're going to count them as part of the emergency shelter population or the transitional housing population. You're not going to count anybody on the point-in-time count because they're in an HPRP program. On the housing inventory count, when you are reporting inventory for programs of type HPRP, you are going to count beds in which you have sleeping people who are enrolled in HPRP programs with a housing status of literally homeless, and that's from program entry, who have, as of the date of the HIC, received at least one instance of HPRP assistance, whether it's a housing relocation and stabilization service or financial assistance, and who are occupying conventional housing. In other words, they've moved out of emergency shelter if they were in emergency shelter when enrolled in the program. So on the HIC, you are going to include a count of beds, a bed count, but what you're actually going to be counting is the number of people who are in beds, who were literally homeless at the time of program entry, who are receiving HPRP assistance, and who are occupying conventional housing. I hope that clears things up. If it doesn't, you can see the URL on the screen, hudhcre.info/helpdesk. You can submit a question there under the HDX topic. The program system is HDX, and then the topic and subtopic is AHAR, or I'm sorry, HIC or PIT.
Great. Thank you, Molly, very much. That was excellent information. And again, for those questions we didn't get to, we invite you to please submit them through the virtual help desk. Also, as a reminder, this webinar recording and PowerPoint presentation will be posted next week on the HUD HRE website. Thanks very much to Tom and Louise, and to our presenters, John, Matt, and Molly, and thanks to everyone calling in for taking the time to attend this webcast. You will be receiving an email with a link to a satisfaction survey, and we'd very much appreciate your feedback. Please join us next week for Continuum of Care Checkup. On behalf of SNAPS, thanks again and enjoy the rest of your day.